If you are considering a Medicare Advantage plan, then you definitely need to see this. Today, I'm breaking down the top 3 Medicare Advantage nightmares that you really want to be aware of if you are on Medicare or you are aging into Medicare soon. Okay, so I really want to preface this video by saying that I am not 100% anti-Medicare Advantage plan. I do believe that there are certain situations where a Medicare Advantage plan may be the best fit for you. And in some parts of the country, there are Medicare Advantage plans that have very attractive benefits. But I do believe, after being in this industry for this many years, we see common themes from people that call into our office that are on Medicare Advantage plans that want off. I'm going to talk about those, and I'm going to share some insider tips, things that you really want to be aware of if you are on Medicare, or ideally before you get onto Medicare. So the first thing is that Medicare Advantage plans have provider networks, which can change at any time. One of the biggest things that makes Medicare Advantage different than traditional Medicare is that Medicare Advantage plans are managed care plans, like HMO or PPO plans that work with contracted provider networks. Typically, providers, doctors will sign a contract with an Advantage plan for a calendar year, and then they have to see patients that have that plan. However, these doctor networks can change, and although it's not common, I've personally seen networks suddenly change in the middle of the year with very little warning to the people on the plan. And it can leave seniors feeling really confused, especially when you are maybe in the middle of an ongoing treatment or you have appointments scheduled with your doctor who now no longer takes your plan. And Medicare Advantage plans are calendar year contract plans. So you're typically stuck in that plan network for the calendar year. Your doctor leaving the plan is not a qualifying event to change your Medicare Advantage plan in the middle of the year generally. Additionally, there are a few prominent hospital networks like MD Anderson Cancer Institute and Mayo Clinic that notoriously don't take any or very few Medicare Advantage plans. Secondly, and this is a big one, many Medicare Advantage plans require much more prior authorization for certain services compared to traditional Medicare. So most Medicare Advantage plans do require prior authorization, and it's typically for your higher cost, more expensive treatments and services. And prior authorization is meant to cut costs. So your doctor gets pre-approval from the insurance company before you even receive the service. So you're not getting the care until the insurance company pre-approves this service, right, with the doctor. Insurance companies love prior authorization because it controls their costs, but doctors typically feel that it hinders your care. So in fact, 91% of doctors say that prior authorization leads to negative clinical outcomes for their patients. And 34% say that prior authorization has led to a serious adverse event for a patient in their care. So prior authorization isn't great when it comes to your health and getting the care that you need. So in 2021 alone, more than 35 million prior authorization requests were submitted to Medicare Advantage insurers on behalf of Medicare Advantage enrollees. The volume of prior authorization determinations varied across Medicare Advantage insurers, up to 2.9 requests per Anthem enrollee, so per person. Over 2 million prior authorization requests were fully or partially denied by Medicare Advantage insurers. Just 11% of prior authorization denials were appealed, and the vast majority of appeals resulted in fully or partially overturning the initial prior authorization denial. So this is basically showing you that Advantage plans are denying a lot of the prior authorization requests. And then when people, not a lot of people, but when people go to appeal these denials, most of the time the appeals are overturned. So then why did the Advantage plan deny that care to begin with? This is really one of the biggest, darkest sides of Medicare Advantage, in my opinion. And things seem to unfortunately be getting worse instead of getting better. You may have seen in the news information about AI and algorithms that are now being used to deny care for people that need it. Definitely something that you want to be aware of. And we see this a lot with people that are in skilled nursing homes, or they fall and they get transferred to a skilled nursing facility. That is one of the places where you see this a lot on Medicare Advantage. And finally, the third Medicare Advantage nightmare that we hear about from people is not realizing that you have to satisfy your plan's maximum out of pocket before coverage kicks in at 100%. So many agents and brokers out there who are selling Medicare Advantage plans love to say that these plans have a $0 deductible, which is misleading because many people equate $0 deductible to I don't have to pay anything when I go to the doctor and hospital, which is not how it works on Medicare Advantage. While you may have a $0 deductible, you typically will always have copays and coinsurance that you will be responsible for at the doctor and hospital, and you pay up to your plan's maximum out-of-pocket. So the maximum out-of-pocket limit in 2023 is set at $8,300 per calendar year, although it could be less on certain plans. That means that if you have a catastrophic medical event, you will have to pay your plan's set copay or coinsurance for that service until you've met the maximum out-of-pocket for your plan for the year for any covered medical in-network service. And it also does not include Part D prescription drug coverage. One of the biggest things that we see on most all Medicare Advantage plans is that you are responsible to pay 20% of the cost of things like chemotherapy, expensive injections and infusions, or durable medical equipment, things like oxygen, wheelchairs. You're paying 20% of the cost of that until you've met your plan's maximum out-of-pocket for the year. So for some seniors who don't realize that they will be responsible for this high out-of-pocket maximum that are on a fixed income, these surprise medical bills could be devastating. Okay, so those are my top 3 biggest kind of Medicare Advantage nightmares that we hear about. But like I said in the beginning of the video, my team and I, we are licensed independent insurance brokers. We work with both Medicare Advantage plans and Medicare Supplement plans. And I believe that there is not a one-size-fits-all plan for everyone. The best plan for you is going to be dependent on several different factors, including your budget, your needs, your health, where you live. If you do choose a Medicare Advantage plan, it's important that you choose the right Medicare Advantage plan. So that's what my team and I can help you with. My team and I are licensed in 46 states. Our service is 100% free of charge. And this is what we do all day is we help seniors who call us to find the best plan at the best price for their needs. And then we offer them free policy service for life. So our service is completely free of charge. And of course, we would be happy to help you. It's really important to know that if you are turning 65 and you're going on a Medicare for the first time, and you decide to go with a Medicare Advantage plan, and then later on down the road, a few years from now, you decide you want off of your Medicare Advantage plan, you may have to pass through medical underwriting in order to qualify for a Medicare Supplement plan. Those are the plans that work with your traditional Medicare benefits. A lot of people don't know this. So the Medicare Supplement insurance company could potentially deny you based on your health history or your current health status. So it's only when you are brand new to Medicare Part B that you can purchase any Medicare Supplement plan you want without medical underwriting in most states. And that is a really important tip that you should be aware of, that you should share with your friends and family if they are getting onto Medicare, because if you don't know that, it could be really detrimental to you later on down the road. It's really important to talk to a broker that you trust, that can help you find the best plan for your needs. Please don't hesitate to give us a call. I don't run ads on these videos. We don't monetize our YouTube videos. We make our living by seniors who find us here online, give us a call, and we get to help them find the best plan for their needs. So we would love it if you give us a call. And if you're watching this and you're thinking, what even is Medicare Advantage? Then I have a few other videos where I talk more in depth about what Medicare Advantage is and how it works. So I'll link those below. You definitely want to watch those as well. Thank you so much for watching today. Please leave any questions and comments for me below. Subscribe to the channel if you haven't done so yet to see more content like this. And you can like the video, share it with a friend. Thanks again, and we'll see you soon.